streets of Kolkata have been filled with angry protesters, appalled by the rape and murder of a trainee doctor on August 9 while she was resting in a hospital break room after a grueling shift. Demonstrators of all ages and professions have joined together. The crime haunts Priyanka, a young anesthesiologist who now worries for her safety.
We never sleep with our doors closed. We never even think that somebody would just walk into the door and do something to our modesty. So we never even thought, this never occurred to us that something like this can happen. Everything was amicable before that, but now there's a certain amount of underlying tension among every aspect. And that is really bad for the system, for us right now.
The young doctors across the state of West Bengal have completely lost trust in the authorities meant to protect them. The government suspended the hospital head following accusation of tampering with evidence related to the main accused, a hospital security guard. The police are also accused of misleading the investigation and trying to pass the murder off as a suicide. Following this, the West Bengal Junior Doctors Front intensified their fight, calling for strikes to pressure the government to take firm action.
The population of the whole nation and the country and the world can connect with us so that nobody forgets Abhaya, so that we remember Abhaya, so that we keep her with us and we fight for her till we get justice. We want fast tracking of the investigation and fast tracking of implementation of all the services that need to be taken care of to give us a safe and sound environment.
This tragic incident once again draws attention to violence against women, particularly in hospitals where verbal and physical assaults are a daily reality. In recent weeks, reports of attacks on healthcare workers have increased. Social media videos have emerged showing patients or their relatives attacking doctors. We witnessed one such incident at a public hospital in New Delhi. The doctor on duty says two relatives of a patient stormed into the maternity ward and began arguing with her. It's a minor encounter, but one that could have escalated.
This was just a small glimpse of what happens. Most of the times we are actually one or two doctors only. And it starts with one or two relatives, they call. And within 5, 10, 15, 20 minutes, we see we are alone against a bunch of 10, 15 people. It's not easy every day.
This violence takes a toll on doctors who are often on shifts of up to 48 hours. Dr. Gotika has been working at this hospital for over 2 years. Between two emergency calls, she takes us to the room where the doctors get to rest. A unisex room that is unsupervised and accessible to everyone.
When a female resident is lying down, she's just taking a small nap. Suddenly some patient rushes in and asks for some help, like the patient is having some symptoms or not. So that relatives or those patients will actually push in and get into the room. Every single day when I come to the duty, this thing is inside my mind. That something or the other thing will happen. There is no point that I am happily coming to the duty.
Frustrated by the authorities' inaction, female doctors are taking matters into their own hands. These medical students are taking a self-defense course organized by the Delhi police. In this session, they learn to use everyday objects to counter their attackers.
We should have confidence in ourselves that, yeah, we are enough and I can protect myself. And yeah, we can always use the techniques that they teach us.
There are so many times we have to do late night duties. We go, in the AM, early AM, 1 AM, 2 AM, we have to go back to our hostels, to our houses. So in that case, our security is very, very important.
Police officer Kiran Sethi has been training medical staff in self-defense across the capital. Her classes draw hundreds of new participants each time, offering a last hope for these women in a country where less than 1% of accused attackers are convicted.
After studying for so many years, at this stage of their lives, if these doctors encounter an assailant, we prepare them to protect themselves. That's why the Delhi police are doing this, to motivate and build their confidence. I don't want them to be taught these self-defense techniques after an incident is reported. It should be taught early on, and there should be a special class in schools for it.
According to the Indian Medical Association, 75% of doctors have faced workplace violence, a double burden for women, particularly given that India recorded nearly 32,000 rape cases in 2022.